To find the sternal angle, place your finger in the hollow curve of the suprasternal notch and slide your finger down about 5 cm until you feel the bony ridge that join the manubrium and the sternum. That is the sternal angle. Move your fingers laterally and find the adjacent second rib and costal cartilage using two fingers. Walk down the interspaces at a time in an oblique line. Do not count the interspaces close to the sternum. Find the T12 and adjacent 12th rib. Walk up the interspaces. Ask the patient to lower his neck and with the patient's neck flexed, find the most prominent spinous process. Usually it is C7. Now count down from C7 to T12. Examine the patient's chest and respiration. Note its shape, any symmetrical or bony deformity. Observe the rate, rhythm, depth and effort of breathing. Listen to the audible sound of breathing. Count number of breaths per minute. Inspect the patient's neck for supraclavicular, sternocleidomastoid or scalene muscle. Palpate the sternal notch to check the position of the trachea. It should be in the midline position. Check the nail bed of the patient for any cyanosis. Inspect and observe the posterior thorax for any symmetry or deformity. Examine the overlying skin. Palpate and locate if there are any areas of pain and tenderness. Place your thumb at the level of the 10th rib and spread your fingers slightly across the lateral thorax. Ask the patient to inhale and exhale deeply and fully. Watch the divergence of your thumbs normal about 2 cm and feel for the range and symmetry of movement. Ask the patient to say 99 and feel for vibration.
9 9
Listen to the intensity, pitch and duration of a percussion and note the sense of vibration. Auscultate the posterior thorax. Begin at the apices and proceed downward. Move in a symmetrical form from side to side in a lateral pattern. Compare the breath sound in a symmetrical area. Listen to the pitch, duration, and intensity of the inspiratory and expiratory sound. Normal sounds are soft and low pitch. Bronchial breath sounds are little harsher and louder. Listen for any crackles, rustles, or whizzes. Determine if there is any advantageous or added breath sounds which are superimposed on usual breath sound.
नंतरून लागत ना चेकअप करायला तपासायला.
Ask the patient to lay down in a supine position. Examine the chest and feel for any deformity or lesions. Percuss the anterior chest and the lateral chest. Ask the patient to breathe with mouth open and listen to the sound of the breath and their intensity. Listen for any sounds like dots in time, fine crackles,